Today we launched this project. I visited this project in company with members of Rotary Club Kampala Springs, my wife and Anini Nyesiga. And I was really thrilled what happened. I saw the glance in the eyes of the medical doctor. I saw the glance in the eyes of the experienced midwife giving birth with his mother twins. And then we saw all the instruments we were able to buy thanks to this global grant. It was a baby warmer, it's an incubator, it's a lot of instruments, it's the lighting of the buildings, and finally they will begin with the watch project next week. So we have all around done what we have promised in doing this global grant in combination with these two Rotary districts and Rotary clubs. We had the opportunity to get a respectable amount from Dear Foundation. It's a private foundation in Switzerland. The president of this foundation I know very well, it's Sonja Dinner, and she was thrilled about our idea to combine MCH and WASH and was willing to support this project with a respectable amount.
We were delighted to receive PDG Urs, who came over to Kabwohe to follow up the global grant project, where he was one of our big partners that contributed funds towards the project that we are now implementing. This project was launched on the 2nd of December, and we launched it with a medical camp, because once we received the equipment, we wanted really to see the equipment at work. So we organized the medical camp, whereby over 1,000 people were treated against different ailments, but mainly we were looking at people who had issues with their eyes. We managed to get them some spectacles. That day we actually gave out 800 specs to some of the people who came on that medical camp. And then we had tests of HIV, we had tests of cervical cancer, we had tests of other ailments, which were conducted by the doctors and the nurses of that health center. But we also got some Rotary volunteers, some of whom came from Mbarara University and other neighboring health institutions.
So we were able to hand over all this material officially today. And being on the place, we saw that just besides this health center, a new hospital is growing, a hospital in the name of the Ministry of Health, of the government of Uganda. And I think both we starting small and ending up big is a sign that these efforts done by Rotary get some great respect from the government, that they placed the hospital in this region, a region where a lot of births are given a month, 300 a month. If you multiply this, it's between 3,500 and 4,000 newborns. It's a huge number, and these babies are now secured by all the instruments we had the possibility to deliver.
The Global Grants project has gone on well. One is that we have managed we managed on that day to deliver equipment, maternal and child health equipment, which was delivered to the hospital on that very day. And recently, when PDG Urs came to pay a visit, he came and found most of the equipment had already started working. We were even lucky, we found one of the incubators had a set of twins who had been born a few hours ago, and they were in that incubator, which was working perfectly well. Now, by the time we went there also, they had already finished fixing the solar system. Originally, they were only relying on the hydroelectricity, which of course is quite expensive. But now they are using solar energy, solar power. So the theater is well lit. The surgical wards, especially for the mothers, the pregnant mothers and the ones who have delivered, have now enough light. They are no longer using artificial light in the theater, because the theater now is very well powered. So even when they don't have the hydroelectricity working, we have the solar system which has been fixed and which is working perfectly well. This component involves water pump. There is going to be supply of water pump. We are also going to have an overhead tank, a tank that has a capacity of 10,000 liters. So which means we shall be pumping this water to the tank. Then from the tank, the water will be going by gravity to the different sections of the hospital. Now this of course will improve on sanitation, because people will be able to wash their hands, will be able to have all departments of the hospital very clean, because they will be having enough water all the time, and all their toilets, they will be using flush toilets, whereby the water system will allow them to use the system properly without any problem.
So I thank Rotary Club of Kampala Springs very much that they have realized this project, primarily in paper exchange, and now in hand work, and giving over the material we bought to the responsible for the hospital in favor of mothers and children, and in fathers as well. So I'm happy, and I am sure that I will revisit this place when the hospital will be opened. They speak about January, February, it will be done. So I have the opportunity to visit this place again under new circumstances. I am already happy now to visit this center. And the most I want to say is thank you for all what you have done as members of this club, Kampala Springs, to realize this project within a very short time in favor of mothers and children. Thank you.
We want to thank very much our partners who managed to raise the resources to be able to fix these items that we managed to fix in that hospital. And before PDG Urs left, they also gave him the indication of the different equipment that they may require in the hospital, in addition to what we have already provided. And he was extremely happy and extremely positive, and he promised that he's going to do what he possibly can to make sure that we equip this hospital even more, because he could really see the cries of the people that much as we have given that assistance, but the demand is still massive. They still need a lot of items, so that, to make the hospital perform to its capacity. So we want to thank them once more, and to promise that whatever they manage to bring, we shall also top it up as a club by through fundraising and other activities, so that we can continue to make sure that this Health Centre IV, which we've started to assist, we can continue assisting it until such a time when they can be able to solve the biggest percentage of the problems that they are having.